Please welcome to the podium Dr. Michael Rao, President of VCU and VCU Health System.
Good afternoon. On behalf of Virginia Commonwealth University, our health system, and the VCU Massey Cancer Center, it is really my privilege and honor to welcome all of those who are joining us virtually, as well as to have the opportunity to welcome the First Lady of the United States, Dr. Jill Biden. Dr. Biden's visit to Virginia Commonwealth University, and frankly, in so many ways, is so critical. It really highlights the importance of our groundbreaking research at this institution, and of course, our groundbreaking treatment as well, as Virginia's first National Cancer Institute designated cancer center. And I want to say, Dr. Biden, you all know that she's already been a very visible member of our community, committed to our care providers and our researchers, and she said, "This is the fight of our lives." I thought that was a wonderful statement. Yes, indeed, it is the fight of our lives for every human life. Yeah. Cancer affects us all, but it disproportionately impacts minorities, which is exactly why VCU focuses its work on addressing disparities in cancer prevention, cancer treatment, and cancer research. This commitment is core to who we are as the state's largest safety net hospital and as the region's #1 hospital. We are committed to excellence in patient care for every patient, and we are committed to access in saving and improving every human life that we possibly can. We're also really pleased to have with us today and to welcome Ned Sharpless, who is Director of the National Cancer Institute. He spent his entire career dedicated to cancer research and treatment at the highest and most important levels. We look forward to working with Dr. Sharpless in the coming months as we pursue comprehensive cancer center status with the NCI. Ned, welcome.
Thank you, Dr. Rao. Dr. Biden, it's really an honor to have you come to join one of the NCI-designated cancer centers, the Massey Cancer Center. The Cancer Center program, which was created really in the modern era by the National Cancer Act of 1971, is the crown jewel, or one of the crown jewels of the nation's biomedical research program. To earn designation, it's very difficult. The standards for NCI designation are demanding. A place like Massey has to demonstrate that they provide state-of-the-art facilities with groundbreaking research and life-saving clinical trials. Cancer centers then bring together investigators with from different disciplines to conduct research that really benefits patients directly in the communities where they live. And Massey's work also, I think, illustrates the importance of bringing of centers serving their own communities and doing research to benefit the populations that live in those communities, including the underserved populations. This is critical to ensure that cancer research and the progress we're making is accessible to all Americans, regardless of race, ethnicity, or socioeconomic status. And this is really a crucial part of the NCI's mission to advance health equity by eliminating disparities in quality of care.
Yes.
Cancer centers like Massey are central to this endeavor, not just by conducting clinical trials and by providing high-quality research, but also by training the next generation of cancer researchers. And we met some of Massey's terrific trainees today. Dr. Winn's own career, by the way, is a testament to the importance of NCI-supported training. He is a recipient or a member of an alumni of our CURE program. Everything in federal government has an acronym. CURE stands for the Continuing Umbrella of Research Experiences, and it is a wonderful program that aims to significantly increase the number of cancer researchers from groups that have traditionally been underrepresented in the biomedical research workforce, using a holistic training and career development pipeline that has already supported more than 4,000 scholars. CURE provides support to aspiring cancer researchers at every point along the training continuum, starting as early as middle school or high school, and going all the way through their first training, through their first independent grant as a scientist. We're very proud of that program and the alumni of that program, people like Dr. Winn. Lastly, let me close by pointing out that this year marks the 50th anniversary of the National Cancer Act. That important law I already mentioned that created the Cancer Center program and many other capabilities for the National Cancer Institute. We're commemorating the anniversary at NCI of this important act with our colleagues across the nation, including those here at VCU, by declaring to our patients and their supporters that nothing will stop us. Nothing will stop us in our efforts to do what President Biden himself recently said, which is ending cancer as we know it. So nothing will stop us in pursuit of that worthy goal, and I welcome the support of this group in doing that. It's now my pleasure to introduce Dr. Winn. Okay, yeah. Thank you. Rob is someone I've known for a while. Rob is a pulmonologist by training, who is a distinguished physician scientist and was prior the director at the University of Illinois and was recruited here in 2019, and VCU was a great hire, by the way. And is really done some very important, interesting work for the NCI, and is a great partner for our plans and programs. So thank you, Dr. Winn.
First of all, I just want to thank everybody. It's an exciting day. We want to welcome everyone to this incredibly exciting occasion, and especially we want to thank Dr. Biden for choosing VCU Massey to make her first visit. We're honored to host her here today. I have to thank Dr. Sharpless for his unwavering support and fighting for cancer. As the leader of the NCI, it is clear that we take our lead from him in the context of outstanding excellence, innovative and cutting-edge science, but that he cares equally as much about reducing and eradicating cancer, but reducing and eradicating health disparities. And I want to thank him for that. I also want to thank, they always say that a house is built on a foundation. This one was built on a foundation of outstanding giants who I'm standing on their shoulders that allow me just to do more things at Massey, and that is Dr. Lawrence and Dr. Ginder. I think that both the first Cancer Center director and the one I just followed really is making this easier. I've just said to myself, I just don't want to mess things up. It's like a closing pitcher. They've actually pitched 8 innings. I just want to finish off the 9th one. We are pursuing comprehensive cancer center status, and I owe it a great deal to both those guys for setting this up. Dr. Rao and Dr. Kellerman. Dr. Rao, our president, and Dr. Kellerman really is our VP, are honestly my North Star in the context of what I should do in the context of a cancer center. It's not often that you get to see leaders who talk a lot, but who walk it every day. And even when sometimes I have doubt, I just usually use these two guys to sort of prop me back up again to make sure that I'm doing the right thing. And I want to thank both of you very much. Dr. Buckley, our dean, everybody needs a counterpart. And sometimes what happens in cancer centers is they always talk about this interesting thing, but the cancer center director and the dean don't get along. That's not true here. And I think that to Dr. Kellerman's point, he's introduced this concept of one team, one fight. And I want to thank you, Dr. Buckley, for being such a great partner in this. So thank you, sir. And listen, nothing gets done if you don't actually have support from the state. So that's just a fact. I mean, you can get some done, but the outstanding governor we have in the First Lady, Governor Northam, has actually been through the thick and thin with us in the context of supporting VCU, supporting Massey, but also listening to our communities. And sometimes that was a hard thing to do. And his illustration of courage in the context of getting us through this COVID and the courage to understand that once we're beyond COVID, cancer is still going to be there. Your support for us, I just want to publicly just say thank you, and thank you, sir. And the House and Senate of the Commonwealth of Virginia, I mean, there are so many members that have just been great friends and supporters of us, and that's been amazing, as well as Mayor Stoney, who was one of the first people I met in Virginia and in Richmond, who has been a stalwart champion of this cancer center. But most of all, I'd like to thank a couple different groups. One is our Massey Nation. That Massey Nation has been with us through thick, thin, through the ups and the downs. People like Becky Massey, the chair, Mike Grassley, and Rudene, and George Emerson, who has taught me one thing, that persistence always matters when you're on the right side and doing something good. So I want to thank my Massey Nation, all 75 of them, and say I appreciate you and couldn't have done this without you. Certainly, I want to thank our staff and our docs and our nurses and just everyone that's part of the VCU Massey Nation for making this happen. But I got one last thank you. That is to the Facts and Faith Friday faith leaders, who honestly, I've been here since December 2019, didn't have to partner with me, didn't have to actually work with any of us, but chose to not only work with me, but become, for me, a place that I call home in a family. The work that they've done has been tireless, and you'll hear a lot more about that, about how a partnership between the Little Oak Cancer Center and the community has made a difference in our community, particularly our African-American and most at-risk population. So again, I want to thank you, and now it is my honor to introduce Dr. Jill Biden, the First Lady of the United States.
Thank you, Dr. Winn. And, you know, I just met Dr. Winn, but I feel like I already have a friend for life. So, you know, he took me on the tour. We talked, it was great. And Governor Northam is here with his First Lady. I had to, they're sitting up there. I had to remind the governor that, you know, as a Virginia school teacher, I'm one of his employees. So thank you. It's nice to see you. And so, you know, from your groundbreaking research to your community outreach to your radio show, you know, everyone can see how passionate you are about bringing communities together and saving lives. And in a month dedicated to remembering the history and honoring the contributions of Black Americans, it's clear that you are continuing the legacy of Dr. Daniel Williams, the first physician to successfully perform open heart surgery, which is so incredible, and Dr. Helen Dickens, the renowned OBGYN who also founded inner city clinics for cancer and teenage pregnancy, and so many others who have helped shape the future of medicine. So I recently had the chance to virtually visit the National Cancer Institute, and Dr. Sharpless told my team about you and the great things that Massey is doing. So I just knew that I had to come here and see it for myself. So Dr. Sharpless, thank you for your leadership at NCI and for accompanying me today. And thank you all, really, for hosting us. And it was a great visit to the labs. So I have to tell you, it was like so incredible. I got to see molecules and things that I never see in, you know, a classroom of literature. And I saw DNA being separated from bacteria, just amazing things. I wish you all could have been there on the trip through the labs. The physicians that I saw, the dedication to their work is so incredible. And obviously, medicine is a science, and effective treatments and cures require inclusive data and rigorous study, and of course, analysis. And learning more about the innovation and of this community and the research is just so inspiring. And so many brilliant minds are, all of you are pushing us forward today. But medicine is also an art, and the best science in the world can only go so far without trust and collaboration and communication with those who need it most. As we're discussing today, the divide between clinics and communities persists. And for a variety of reasons, many Americans are being left behind in one of the most medically advanced countries in the world. And the results are health inequities and lives lost. And we owe ourselves better. And cancer is so personal to me. In our lifetime, the president and I have found ourselves sitting alongside far too many chemotherapy chairs and hospital beds. Cancer has taken more lives of our friends and family than we could ever imagine. It's broken our hearts, and it's stolen our joy. And we're not alone. I'm sure the people who are with us today, those who are here and there, the people watching, I'm sure you all have stories of your own. Cancer touches everyone. But out of sorrow, we found purpose. The president and I made it our mission to help end cancer as we know it. And we saw how much potential there is to bring people together around this cause, to break through the obstacles and to connect the disconnected. I was in my early 40s when a close friend of mine named Winnie was diagnosed with breast cancer. She was a mom, and her 3 kids were teenagers, not much younger than my own kids. And after Winnie confided in me that she had breast cancer, another friend confided in me, and then another, and then another. In 1 year, I watched 4 of my friends face down that same deadly disease. 3 of them survived, but Winnie did not. And I felt so helpless. And I hated knowing how many women died because back then of the shame and the secrecy and the misinformation that surrounded breast cancer at the time. And I wanted to do something, but I wasn't a medical doctor or a scientist. I was a teacher. So I turned to what I knew, education. And with the collaboration of doctors and nurses and breast cancer advocates, we started the Biden Breast Health Initiative in Delaware, my home state. And together, we created an education program for girls in high school. We knew that if we could teach them about screenings and self-examinations and healthy habits, that hopefully they would take those messages home to their moms and their grandmoms and their aunts and their sisters. And over the next few years, we visited almost every school in the state of Delaware, and we helped create honest conversations about a difficult subject. And we met families where they were. In the face of challenges as enormous as cancer and health disparities that plague all of our communities, it's easy to feel helpless. But we're not. The researchers and medical professionals here at Massey are pushing the science of medicine every day. But I'm just as grateful for the work you do for the art of medicine as well, building trust and relationships, empowering communities to bring their own talents, to this fight. In fact, this center's work, and especially Facts and Faith Fridays, show us what's possible when our leadership reflects the communities our organizations serve. From life-saving information about COVID to cancer screenings and prevention, to addressing the conditions that affect wellness and like housing and employment. This group is tackling some of the most important health issues right now. And they're doing the work, by working hand in hand with the Richmond community and beyond, and meeting people where they are. This group reminds us that you don't have to have a medical degree to help. You just have to reach out to the people who are hurting. Faith leaders were some of the first healers, caring for people's bodies and their spirits. And our churches, our temples, our mosques have a critical role to play in the health of our communities. The Facts and Faith group, all of you here and all of you watching today are critical to creating a healthier world, because you know what's at stake and how to earn trust. You know how to empower the patients who too often feel so powerless, and you are saving lives. This has been a difficult time for everyone. Just this week, we passed a grim milestone. 500,000 Americans gone because of COVID-19. And though we all feel the weight of that number, communities of color are carrying a heavier share of that burden, mourning their loved ones in higher numbers. And it's not just this pandemic. Health inequities have hurt communities for far too long. Suffering and pain surround us. And yet, out of suffering, out of sorrow, you have found purpose. As the Gospel of John says, the light shines in the darkness, and the darkness can never extinguish it. You are that light, showing us what is possible when we allow our hope to lead. Building a bridge between science and art, between research and real lives, between faith and facts. And that's why I'm here today, to listen and to learn from you. So, Dr. Winn, do you want to lead the discussion? Okay, thanks. Hello. Hi.
Thank you, Dr. Biden. That was inspirational. I'll keep my comments short. We have a number of things to mark as major events. The centennial of Henrietta Lacks during this period of time is something to make sure that we reflect upon, as well as the 50th anniversary of the National Cancer Act, which created such programs like we have right here at VCU Massey. In 1975, we were the benefactor of giants then, Ted Kennedy, President Nixon, and others getting together that said, what would happen if you actually had an academic medical center and the government and the NIH in partnership? Could we make an impact in cancer? And the answer was absolutely we had. But as Dr. Biden just mentioned, it is clear that another thing that we must take some mark of and reflection on is the passing of 500 deaths around COVID. I do want to thank you, First Lady, President, Vice President, for allowing us as a country to just have a moment to pause and reflect. And for that, I really want to say thank you.
Thanks. Thank you.
crazy thing about this is that, interestingly enough, it's caused us to think differently. I'm not saying that we're going to abandon our commitment to basic research or funding of our future scientists. In fact, I'd say we need to double down. But I also think we need to think about the end. Now, everyone in this room, and definitely Pastor Gray and Rudene Mercer Haynes and these guys and my president, know that I love science. If loving science is wrong, I do not want to be right. I've said that before, and I'll say it again. But what I've recognized is that as much as my love for science is, if the miracle drugs and the cures that we have, as great as they may be, if people don't accept them because they don't trust us, then it's only doing some, but it's not doing great. In that context, I'm reminded what President Roosevelt, that is, Teddy Roosevelt, Theodore Roosevelt, once said, that many people now quote, my grandmother, who told me to make sure that I reminded myself and everybody of this one, was that he said that people don't care how much you know until they know that you care. And I think that concept of NCI designation and what we did 50 years, for the past 50 years, of the cutting edge, innovative science connected to the humanity and caring is what the new cancer centers of the next 50 years will be able to do and make even more progress. In that context, I want to show you the team that I have. And they are amazing. They are amazing. And I know that as we're coming close to the end of Black History Month, I'm reminded of a couple things. One is obviously the Richmond 34, that can't forget. But Martin Luther King and his I Have a Dream speech that was inspired by Preeti Hall is an amazing and inspiring dream. But Dr. Ewing, and I was recently at the University of Chicago, the second African-American now, Cancer Center Director of an NCI-designated cancer center, had a discussion this weekend, and we said, we too have a dream. And our dream is to literally, with the tools that we have and will create, eradicate cancer. A world without cancer is possible, with research and with effort. And last but not least, eradicate health disparities. And it's in that context, that I am proud to introduce this team. As we say, one fight, one team. This team is amazing, and you'll hear from them now. This is great because I get to introduce Dr. Matin. Dr. Matin, he is our interim head of our Division of Hematology and Oncology. He is one of our chief leaders of the Cancer Service Line, along with Dr. Doug Arthur, and Dr. Candace McGuire. And in fact, is really an example of what you heard at NCI about the NCORP, that is the NCI Community Oncology Research Program. Mm-hmm. We have one of only 14 minority NCORPs in the country. And it's through his leadership, as well as Dr. Gray, Dr. Sheppard, who you'll hear from, that we are making amazing strides. He's going to tell you a little bit more about that. But things that are on the page that can't be talked about is his heart. And from day one, when I arrived as a cancer center director, he and I actually made a commitment that he would essentially always keep me straight if I went off the bad path that we have. The truth of the matter is, I want to thank you, Dr. Matin, and if you would, share something about your journey and the end.
Thank you, Dr. Winn. Thank you for your kind words, and thankfully I haven't had to set you straight so far. You're doing great. Madam First Lady, welcome to VCU Massey. We really appreciate you taking the time to come and visit us. I'm delighted to share some thoughts and concepts about our Massey NCORE program. The NCORE is the NCI's Community Oncology Research Program. There's 46 NCORE programs around the country, and they really help form a platform whereby the innovation through clinical trials from the NCI and other cooperative groups can be brought to our cancer patients in the community, because most of our cancer patients are actually being treated in the community, not all in the academic centers. So really the NCORE program allows a vehicle for those clinical trials to bring those innovative drugs to our patients in the community. As Dr. Winn mentioned, there are 14 minority underserved NCORs, which are really focused on serving the minority underserved population and ensuring that there is a fair representation of minority underserved patients on clinical trials. We don't want those patients to be left out. So we are one of those 14 minority underserved NCORs in the country. That's something we really pride ourselves on. And I think because we are also an NCI designated cancer center, we really feel that uniquely puts us in a position to take some of the innovation that you saw firsthand in the lab today and use it to the benefit of our patients in our catchment area. No matter what their zip code is, it really should be accessible to all. Massey has had a long commitment with the minority community oncology programs dating back to 1990. So it's a long 30-year history. As Dr. Winn already mentioned, it's really a lot of the leaders that came beforehand as well. So we're extremely proud of that. And the results speak for themselves. We have been, over the years, able to maintain 30% enrollment of minorities in our clinical trials. And that's something that we are extremely proud of. Now, obviously, all of this work requires a village, literally. We are really fortunate to have some wonderful people here at VCU and at the Massey Cancer Center at different levels. We have amazing scientists. We have providers who take care of patients. We have our clinical trial staff, nurses and other staff who do an awesome job, and our nurses who work in the clinic. And then we have our affiliates, because our NCOR is built on us as kind of being the mothership here in Richmond, but we have our community affiliates, some of whom are in Richmond, but some of whom are rural Virginia sites, which is equally important that rural Virginians have access as well as the underserved population of the greater Richmond area. So we have 7 affiliate organizations around the state and a total of 19 actual sites that are available for patients to be seen and access clinical trials. And that really spreads us out on the map across the Commonwealth of Virginia. We go as far north as Winchester, South Hill in the south, on the west, Lynchburg and Virginia Beach on the Atlantic, and of course, the greater Richmond, Petersburg metro area. In terms of otherwise, our accrual to these, as I mentioned, we maintain a good minority accrual, but we also have a lot of treatment trials. About right now in our network, upwards of 30 clinical trials are available for our affiliate sites and for us to enroll patients on. That includes treatment trials and also cancer prevention and control studies, which are very important, and cancer care and delivery, which Dr. Sheppard is the lead for and will tell you more about. The one study in particular that I wanted to highlight is, and the timing is impeccable because it just opened 12 days ago, is the Cancer Moonshot Biobank Study. And I know that's a name that's dear to you because of the Cancer Moonshot Initiative that was led by then Vice President Biden. And we really, are now seeing the fruit of that from the work from 4 years ago, and are really excited that we are able to open that study here at VCU and at Lynchburg, which is one of our rural sites, which means that a patient who's there in Lynchburg does not have to drive 3 to 4 hours to come here, and they can get a biopsy there. Their sample is then sent to the NCI, and then the results of that biopsy can help put them on a clinical trial or appropriate treatment. So these are really some of the reasons why a lot of us have come here to VCU Massey and stay here, but we realize there's still a lot more work that needs to be done, but we're excited for the future, especially with Dr. Winn at our helm, our fearless leader. Thank you.
Thank you.
I'm going to next introduce Dr. Sheppard, who is an amazing researcher in her own right, world class, but who also is a student like I am of Harold T. Freeman, who recognizes that sometimes in science there's a disconnect between the discovery sciences and the implementation sciences. Mm-hmm. And we have also considered that there's also a third disconnect, that sometimes the implementation of that into the community. As such, she's our Associate Director of Community Outreach Engagement, and she's going to tell you a little bit more about what it is that she does but also our philosophy here at the Massey.
Absolutely. Thank you so much, Dr. Winn. And first, I'd like to just start by thanking you, Dr. Biden, and also you, Dr. Sharpless, for the programs that you have for underrepresented minorities. I stand on the shoulders of those before me, and I'm a recipient and have benefited from those training programs. And so I'd just like to say thank you for that. Because of those programs and that investment from the Cancer Center, I'm here, and I can pay it forward to other minorities and underserved individuals. So just imagine being a 7-year-old from an underrepresented minority background and hearing the adults in your life talk about that someone you know has cancer. You don't know what cancer is, but you know it's bad, and you see what it does. You've seen its results. And so you make a declaration and you pray that you're never going to get cancer. Well, you get a little older and you do get a diagnosis, and that diagnosis is devastating to your family. Well, at Massey, we recognize that cancer does not just impact individuals, but it impacts families and communities. And as a result, we work to engage the community. And I'm excited that I'm here because we are working with our community to figure out how can we reimagine what a cancer center should be. We don't just want to be a place where people come when they're sick. We don't want to be a place that only produces great science, but it doesn't translate to the community. We see ourselves truly as Virginia's cancer center, the Cancer Center for Virginia. And so we have a community to bench model, and this model fosters bi-directional relationships between the Cancer Center and the community, where we bring community members in, we hear and learn from them, and then we are in the community and we learn what their priorities are. We also put our outreach and delivery programs in community settings like libraries. And this is helping us to understand how we can truly make a difference in the community. Community engagement activities also are informing our science. We've had community forums, for example, with breast cancer, and as you mentioned, talking about the art of care. And these forums have helped to focus 2 trials that we have for African American women. You may know that African American women are 40% more likely to die with the diagnosis of breast cancer. And so working with community stakeholders, they've helped to refine our protocols to improve uptake of treatment for African American women, as well as uptake of genetic counseling. Just last month, we trained our first cohort of breast cancer survivors who will be champions in the community, and they'll be paid and be a part of our study. And so we're very excited about that. One of the things that we recognize at Massey is that if we really want to change the place, then we've got to be ready to change the face. We have to make sure that our faces represent the communities that we serve. In 2014, the 7-year-old that I mentioned earlier was diagnosed with another cancer. This time it was breast cancer, triple-negative breast cancer. And what could have seemed hopeless, because the survival for that cancer is not as good, was hopeful because of faith, access to an NCI-designated cancer center, timely treatment, and a supportive community. She survived to thrive, and as a result, will have another birthday tomorrow. But today, she's sitting next to the First Lady of the United States of America. And for us, that's what it means to thrive. The community to bench model that power, and we want all Virginians to thrive in that way. Thank you so much for your time.
Wow. That was so powerful. I mean, really, you know, I've heard just in the short time that I've been here, I met, you know, Dr. Sharpless told me about, well, took me to meet 2 people that the NCI supported and gave grants that they're now studying just like you did. And I love that you went out into the community. You know, one of the things that I've done for years now, you know, even when Joe was in the Senate and then as vice president, is travel the country and go to the rural areas that you're talking about, because they're desperate. They are desperate for help. And just maybe, I think it was 2 years ago, I was in the Navajo Nation, and I helped open the first chemotherapy center in that nation. And I want to tell you that people were driving 2 hours to get treatment, and then driving 2 hours back. I mean, so that's just one small example of rural America and their needs, you know, and how, you're right, I mean, it's the community. We've got to get the trials out to people. We've got to get knowledge. We've got to get education. There's so much we have to do, but, you know, with your Faith in Friday's program, we're going to do this. We're going to take it across the nation and get people and make them aware. Really.
I can use this one? Okay, thank you.
Happy birthday.
Thank you.
So, you know, this is just an example of really what we do in the context of partnerships. I'll tell you that there are a couple partners that we couldn't do without. One are the folks in the Massey Nation. And in fact, within that, there's a new generation of young people led by the chair called Connor Ashby, who is teaching younger people within this Richmond area and beyond how philanthropy actually works and how to support the Cancer Center. The other thing is, our other partners, our faith-based partners, has been so much to all of us. And in fact, I want you to hear from who, I mean, these are people that I love. I mean, and they know that we are in this fight together. Rudene Mercer Haynes, I could go on and on, but I'm told that the time is short here. She's a partner at Hunt & Andrews Kurt, LLP. She's a member of that Massey Nation. And in fact, she is really what we call a true community champion. This Facts, Faith, and Friday was really like Gladys Knight in the pitch. You can't have one without the other.
Yeah.
There were three of us that really got together in the context of recognizing the importance of this. The other person is Pastor Gray. Pastor Gray is a true leader. I mean, he's a harken back to what we talk about when you talk about faith-based leaders who are not only providing their ecumenical activities, but understands that the church is an anchor institution. These faith-based organizations are anchor institutions and can do more, and has stepped up to the plate and showed up and showed out at every place he's been, and in fact brought others with him. That whole crew, and we're just showing you two of that Facts, Faith, and Friday, but it runs deep with a number of people throughout this community. So I want you to hear from them about Facts, Faith, and Friday, and a little bit about what they've been doing and where we're going.
Thank you, Dr. Winn. First of all, thank you so much, Dr. Biden, for being with us here today. I know you have tremendous demands in your time, so we appreciate your sharing with us. And thank you, Dr. Sharpless, for being here, in person as opposed to virtually. So when I first learned about Dr. Winn becoming the next director of Massey, I got excited for a whole host of reasons. But one reason I was particularly excited was the fact that at the time, he was the only African-American director of an NCI-designated cancer center. I was so excited about this. I thought this was so important. I wanted to scream it off the rooftops because growing up in a Black community, I realized that there is this level of apprehension about talking about subjects related to cancer, anything and all things related to cancer. And that, of course, is a significant impediment to folks getting great cancer screenings or cancer prevention, and also just having access to high-quality medical care for their ailments. So I was excited, and I was thinking, how could I sort of make a connection between, Dr. Winn, so people could hear and see his philosophy and passion at VCU about sort of making sure that you have state-of-the-art, innovative, high-quality sort of research and cancer treatments and cancer trials, and that's what he cared about bringing to the community, implementing in the community. So I thought it was very important that he be introduced to Black leaders, and particularly Black faith leaders. As we know, the church is the mosque, wherever it is that you worship, is a very central bedrock institution in the Black community. So I sort of set out and made it my mission Again, you heard my day job is a corporate finance attorney. This is not what I normally do. But I made it my mission to connect Dr. Winn with faith leaders. And of course, one of the esteemed faith leaders in Richmond is my former pastor, Pastor Todd Gray, who I met when I was at 5th Street Baptist Church. And he was sort of the embodiment of someone who's passionate about the community. He had a proven track record of being engaged in community outreach. So I was wondering if I got, Pastor Todd Gray together with Dr. Winn, of course, good things would happen. So, of course, I reached out to Pastor Gray, and he wonderfully accepted this invitation to sort of arrange a meeting between the two of them. Well, of course, this meeting happened after the first stay-at-home order had been issued. So that meeting happened virtually on a Zoom call. And there are any number of topics that we covered during that conversation. But the one thing that sticks out in my mind was that we talked about the fact that there's so much misinformation and inaccurate information swirling in the community about COVID, how it's transmitted, how you can get tested for it. And again, remember back in April, it was all very novel. So there's lots of confusion. And I was particularly concerned about the confusion that was created in the Black faith community. So Dr. Winn, during this call, just graciously offered to both Pastor Gray and I to have a conversation with folks in the community about COVID, to sort of be a resource and to answer any questions that we might have. He said he'd be available no matter when we wanted to do it. So we're like, okay, how about Friday at 3? And he was like, okay, we'll do Friday at 3. And so we've had these Facts and Faith weekly conversations every week at 3. And we've invited, Black faith leaders, lay people, anybody who's just really passionate about what we can do more in the community. And of course, as things do, things evolve. Our conversations have evolved. And at this point, I'm going to be quiet, and I'm going to pass the baton over to my pastor, Pastor F. Todd Gray, to talk about, what's become of these conversations, and more importantly, what's been the overall impact in our community and beyond. Sure.
Dr. Biden, it's a pleasure to meet you. I have great respect for both you and your husband. Dr. Sharpless, I'm grateful to you as well. As Rudene has stated, this was a fortuitous coming together because we had no idea that we were going to face the pandemic. And early in the process, there was a lot of confusion in our churches in terms of practice and protocol, how we ought to respond to it. Many of us had lost colleagues and members, and the accurate and timely information that we received from Dr. Winn each week, we were receiving information in real time that we could not have received anywhere else. And it informed us as to dealing with opening churches when we could open our churches, dealing with hygiene and sanitation issues. We have a child development center. It was very, very helpful in terms of dealing with practices that way. And so, one of the first benefits of our coming together was just receiving information so that we could successfully govern our congregations. But beyond that, there was the issue of trust. Because there's always been a reluctance in the African American community about certain things in the medical community. And for Dr. Winn to offer himself, plus he shares our experience, it made it easy or easier to establish trust and to have credible sources for dealing with the pandemic, getting tests, and even more so now in terms of getting vaccines and having people that were willing to deal with vaccines. And I do want to thank Dr. Winn, and I want to thank VCU, because we've had persons across various disciplines who address that Facts and Faith Friday call. The other thing that I would share is that it helped us in terms of dealing with advocacy so that we could get testing in underserved communities. Right now, we're in the process of trying to get those communities that are not being serviced, like the majority community in certain areas, getting their vaccines. And we've developed a wonderful relationship with the Virginia Department of Health, but everybody can use some pushing. And so there have been some conversations where we have pushed to make sure that our communities were represented in getting these doses of vaccines. I could say a lot of things because we dealt with more than just what would be traditional health issues. Everything that's going on in our community of interest to the faith community, we've had discussions of. We've had persons from the governor's office, we've had the mayor, former mayor on, we've had common attorneys on, we had the police chief on, we've had election officials on, et cetera, et cetera, et cetera. It's gone way beyond just traditional health issues. But I think that it bodes well for the kind of a relationship that we'll have beyond the pandemic. I think that what we have done has been innovative. It has been very, very beneficial to the African American community. And I think that it's been very, very helpful in terms of establishing that collaboration with the medical community so that they feel as if they can trust it.
Yes.
So by and large, it's just been a wonderful, wonderful collaboration.
That's great to hear. Thanks for what you're doing, really. Because you're right, it's all about trust.
Thank you.
So I'm going to thank the panelists for your remarks and for your partnership. And literally, we're going to get through COVID, of that I'm certain of. Dr. Biden, do you have any final thoughts or final comments?
Well, you know, I mean, this facility is amazing. What I've seen, the research here, what's going on with cancer and how you're trying to, you know, really address the health disparities in our country. It's about time, you know, that we started getting really serious about this. And, you know, and this pandemic has really shined this bright, hot light on this subject. And I must say, I mean, all over this country, what I have found is that the churches are really bringing the communities together. Because whether it's education, whether it's food, whether it's the vaccinations, you know, you are the centers. And because it's all about trust, it's all about trust. And so I think that the communities of color, they trust you. And now I think it's important that they learn to trust the federal government again, because we want a partner. Yeah. So thank you.
Thank you so much for that. And this is just a little example of how faith is not at war with facts and science is not disconnected from our communities. This is what we can do when we're doing it, and we're, I think, living proof, and we're hopefully setting the example of the 21st century modern day comprehensive cancer centers that others will lead as well. So I want to thank you all for attending our event today and for supporting life-saving cancer research. And I want to thank you all again. Thank you, thank you, thank you. And that will conclude the official part of our program. Appreciate you. And thank you again for the panelists. Appreciate you all.